Hello, so this video will talk about the initial considerations and some of the diagnosis and early management of a myocardial infarction, or aka MI, or heart attack. So I think one of the most important things to kind of figure out early is what is a MI, right? And by definition, that is an obstruction of the coronary arteries, which is the arteries that kind of supply the heart. The heart is its own organ, requires its own blood supply. So if you don't have enough oxygen um, going towards those arteries to the heart, eventually the heart's going to fail, right? Because it needs oxygen just like any other organ. The importance of an MI is because, obviously the importance of the heart as its own organ. So this is why you need rapid recognition and treatment for that. So typically, you have to take an MI within the entire clinical context. Are they coming in, the patient presentation, are they coming with shortness of breath, with nausea, chest pain, chest pressure, especially with those that are older and have more risk factors? That's something that you really have to keep high on your differential because of the high morbidity and mortality that comes with it. So as far as the diagnosis, this is going to be aimed more towards those that are earlier in their clinical careers, maybe taking step 1, taking step 2. This is something that you want to focus on, in addition to keeping that differential high on your list of differentials is the diagnosis. And typically, some of the most common things we do is a 12-lead EKG. The earlier the better. So the EKG is a snapshot of time that it captures the heart rhythms to see if it's abnormal or not. The other thing that we usually like to get is the troponin. Troponin is a cardiac biomarker where if there is you can think of it kind of like a distress signal of the heart. If it's sending out all these troponins, all these cardiac biomarkers, the heart is signaling that, okay, there's something wrong. And there's STEMI, there's NSTEMI. That's something that we can get into later. But usually, if you see ST elevations in addition with elevated troponin, that is bad news. That means there's something going on with the heart, and you need to act fast. So as far as the early management, not going to go too much in depth, but usually the gold standard right now is MONA. That is a mnemonic. It's MONA, stands for morphine, oxygen, nitroglycerin, and aspirin. And then that is the initial treatment. For after that, what's going to help long term is either fibrinolysis, which is a fancy term for breaking up the clots in the coronary arteries. So it's either that, or if you're at a tertiary academic center, you can do PCI. PCI is where someone goes in with the catheter and they manually either break the clot or extract the clot. And those would be kind of the gold standards. Yeah, so I hope that helped. That's it.